Hi, my name is Noma, and this podcast is on our paper titled Stroke Transcranial Doppler in Children with Human Immunodeficiency Virus. HIV, the virus that causes AIDS, remains one of the world's most serious public health challenges. There were approximately 37.9 million people living with HIV/AIDS worldwide in 2018. Of these, 1.7 million were children. A global commitment to stopping new HIV infections has had a significant impact on mortality. Stroke, however, is one of the neurological complications of HIV and a major contributor to the global burden of disease in children. Mechanisms are multiple and include coagulopathy and cardioembolism. The importance of cerebral vasculopathy in the context of HIV-related stroke has been difficult to determine, in part because of the challenges associated with obtaining repeated vascular imaging. A T-cell mediated vasculitis and perivasculitis is recognized in children with HIV encephalopathy and concurrent ischemic stroke. Other observations that support a primary HIV-mediated vasculopathy include the presence of aneurysms, changes in vasomotor reactivity with HIV infection, even in the absence of cerebrovascular symptoms. In addition, the metabolic and immune effects of antiretrovirals may confer additional stroke risk mediated through the vascular endothelium. We conducted a prospective single-center cohort study of children aged 2 to 16 years of age seen at the Red Cross War Memorial Hospital, Cape Town, South Africa. Our aim was to describe stroke syndromes and transcranial Doppler findings in children with HIV and examine the associations between TCD and clinical laboratory data. Our primary hypothesis was that in children with HIV infection, baseline TCD values would be lower than healthy controls. And our secondary hypothesis was that children with HIV and stroke would have TCD values raised on the affected side. Detailed results can be found in our paper. They include, however, a cohort of 42 children, 24 male, age mean 7.8 years. There were 37 controls of children with HIV and no neurology and 5 children with HIV and stroke. To explore the hypothesis that baseline TCD in children with HIV would be low compared to healthy controls, we compared our cohort to published controls and showed that although time averaged mean velocities were lower than an anemic Kenyan cohort, they were higher than other well cohorts. I will show 2 representative cases from the paper. Our first patient was a boy with chickenpox diagnosed at the age of 5. He had HIV diagnosed age 10 and antiretroviral medication started 1 month later. 2 months later, he presented with a right-sided stroke. His MRI findings were consistent with a left basal ganglia infarct and reduced caliber of his left middle cerebral artery, suggestive of an occlusion of the perforator artery, query related to varicella angiopathy. The second case I'll show is of a child diagnosed with HIV at the age of 3 months who also had chronic lung disease. At 6 years of age, he presented with bilateral hand and foot weakness. An MRI demonstrated bilateral multifocal infarcts of different ages, cortical atrophy, and the IV sign. His MRA was suggestive of HIV moya-moya-like vasculopathy. What this adds. This work adds that transcranial Doppler velocities in children with HIV are commonly outside the range for typically developing children. TCD and neuroimaging data in children with HIV suggest an intracranial vasculopathy as one mechanism for stroke, and that TCD may be useful for screening. However, there is a need for larger prospective studies. Current relevance. At the start of the HIV epidemic, neurological complications were not the main focus. Now, with COVID-19, stroke both ischemic and hemorrhagic, has been reported in adults less than 50 years, as well as other immunological effects causing Guillain-Barré syndrome and a Kawasaki-like illness reported in children post-infection. There is therefore a clear need for surveillance of these children, which is being conducted by the International Paediatric Stroke Study. Thank you for your time listening to this, and we hope you enjoyed this podcast and the paper. Thank you to everyone who was involved.